Welcome to the MIPS Audit Readiness and Data Validation Overview. Over the next 11 minutes, we'll address the need to prepare for an eventual MIPS audit and data validation request. You'll be provided with some resources to help you through the process. The Centers for Medicare and Medicaid Services announced on June 20th, 2019, that they will be conducting audits and data validation for the MIPS program performance years of 2017 and 2018, and this will likely extend into future performance periods of the MIPS program. This presentation is designed to help you better position yourself to respond to a MIPS audit request. The Lake Superior Quality Innovation Network, also known as LSQIN, is a partnership between the three state-level quality improvement organizations, MPRO in Michigan, Stratus Health in Minnesota, and Metastar in Wisconsin. We partner together to improve healthcare for Medicare consumers, share best practices, and maximize efficiencies for our clients and constituents. Information provided in this presentation is based on the latest information made available by the Centers for Medicare and Medicaid Services, CMS, and is subject to change. CMS policies change, so we encourage you to review specific statutes and regulations that may apply to you for interpretation and updates. Our objectives are to review the historical perspective on meaningful use CMS audit program, as this was the precursor to the promoting interoperability category within MIPS, and there are many audit readiness lessons learned. Consider the basics of audit readiness, review CMS data validation and audit requirements for MIPS, and introduce you to an Excel audit readiness and data validation tool that can help you prepare and organize needed information and documents should you be audited. Audits do indeed occur, and under the Meaningful Use program, which preceded QPP MIPS from 2010 to 2016, there is a 1 in 10 chance of undergoing an audit. This ratio may be different for MIPS based on the number of program participants and the CMS budget for their contractor to staff the audit and data validation program. CMS did retract meaningful use incentive payments requiring repayment of incentive funds to CMS, and if they did, the likeliest underlying reason was either complete lack of a security risk assessment or having one that was done poorly or not comprehensively to protect patient information. Even if a meaningful use program participant did a good job at this objective, it may be that their organization did not prepare themselves for an audit and was not able to assemble and forward the requested audit documentation or evidence. This lack of readiness for a MIPS data validation and audit could apply to any one of the MIPS categories except cost, as this is data that CMS already has based on claims. Another challenge historically that we'll see carried forward under MIPS was participants not being prepared for material requests by CMS's auditor and being able to turn the request around within the required time frame. CMS has stated that they will allow 45 calendar days to submit materials. Under the Meaningful Use program, a 6-year document retention requirement period was in place, and the audit program itself was outsourced by CMS to a contractor. Both these facts will be true under the MIPS data validation and audit program. Keep in mind that what was done under Meaningful Use has set some precedents for what will be done with regard to the audits under the MIPS program. Let's start to tie the historical Meaningful Use audit program and the MIPS audit program a little closer now. The media has publicized some major findings of the financial health of the Meaningful Use program and detailed concerns unearthed by the Office of the Inspector General. You can see the concern in the headline here that millions of dollars worth of incorrect EHR incentives were paid out, and you can follow the link at the bottom for the Office of the Inspector General report. The amount of identified inappropriately paid incentives amounted to approximately $730 million, as seen in the bold text here. Also highlighted in the OIG report, eligible providers did not maintain support for their attestations, data submitted to CMS. This certainly sets the stage for further attestation to fiscal accountability, and while not explicitly mentioning the OIG report, MIPS in the Promoting Interoperability category are the descendants of the Meaningful Use program, and will certainly be allocated similar fiscal scrutiny by both CMS and the OIG oversight agency. The Office of the Inspector General continued in the report in June of 2017 to recommend steps to remediate the Meaningful Use fiscal discrepancies, including attempted recovery of the $730 million. They included a request for random sampling of provider documentation after the prescribed audit period. This speaks to keeping records for up to 6 years, as well as better education for program participants on proper documentation to substantiate what they did. Lastly, the OIG recommended to include stronger program integrity safeguards under MACRA which is the legislation that enacted the Quality Payment Program and MIPS. CMS sent out an email to subscribers of its QPP MIPS program listserv on June 20, 2019, wherein they stated that data validation and audits for the first two MIPS performance years of 2017 and 2018 will commence as of June 2019. CMS has outsourced the audits and data validation functions to Guidehouse, a consulting firm providing services to the federal, state, and local governments. If you wish to learn more about them, their web address is supplied in this slide. When you receive a notification for an audit and data validation, be sure that it is coming from this organization. CMS provided some high-level details in their announcement, which included a request for information if you are selected will be sent via email or certified mail. CMS did not indicate at the time of this recording which email addresses or mailing address the notification will be sent to. CMS stated in their June 20th email announcement that if you do not provide the requested information, CMS may take further action to include the possibility that you will be selected for future audits. To help avoid this, we are in the process of developing resources to support clinicians selected to participate. Additionally, you are expected to retain your submission data and any additional documents such as screenshots for 6 years. If you'd like to see the detailed data validation criteria for either the 2017 or 2018 program years, that is provided here via the web links. The links will enable you to download a zip file with about 10 supporting files each. At the time of this recording, CMS is just initiating the MIPS audit and data validation process, so they may add additional fact sheets or clarifications. As part of each of these links, there is a PDF fact sheet that you can and should read about the data validation program for the respective MIPS performance years. The CMS fact sheet in this collection of zip files, however, is only 4 pages long, which reflects the fact that they are in the process of developing their approach to audits under MIPS. On the bottom of page 1 on the PDF fact sheet, we get the clearest message about what is to come. Quote, under MIPS, CMS will conduct an annual data validation and audit process. If selected for a data validation or audit, you will have 45 calendar days to complete data sharing as requested or an alternate time frame that is agreed upon by CMS and the MIPS eligible clinician or group, unquote. As CMS states in the fact sheet, they will both validate the data that you submit and then make a determination about who is to be audited. In the past, CMS has not disclosed how they determine who will be audited. Each category that contributes to the overall MIPS performance score, quality, improvement activities, and promoting interoperability will be looked at in an audit, with the exception of costs, and may be included as part of CMS's audit and data validation process. CMS has provided data validation guidance on all 3 categories circled here as part of their zip bundle of files mentioned 2 slides ago. The LSQIN Audit Readiness and Data Validation tool is an Excel resource that provides a starting point, guidance, and a framework to approach your audit and data validation readiness steps. There are 3 tabs: Introduction, General Guidance, and Screenshot Guidance. This tool provides a bit more detailed overview of how to prepare for an audit, what information is needed when collecting screenshots for certain activities and measures, and generally is a good go-to resource to help you get organized around audit and data validation readiness. A link for this tool is on the same page where you launched this recorded presentation. Here you see a few sample screenshots from each of the 3 tabs in the Excel tool. This tool also contains links in the Introduction tab to the CMS zip files for the 2017 and 2018 program years. For any activity or objective where a basic yes/no style of attestation is requested for reporting, you'll most likely need to make a screenshot for that item. Details of best practices to do this are contained in the Screenshot Guidance tab. Taking a screenshot of your system functionality switched on at the beginning, middle, and end of the measurement period is a general approach when documenting that you are utilizing functionality in your system, such as for certain improvement activities that isn't reported as a numerator-denominator, such as all the quality measures. Including a date-time indication from your screen along with a vendor logo is also recommended. You'll read about this in more detail in the Screenshots tab of the tool. As we wrap up this overview on audit readiness, I'd like to leave you with a few tips to help you prepare. Having your documentation organized into electronic files will enable you to respond quickly and within the allotted 45-day time frame. Under Meaningful Use, the contractor set up a secure web portal for submission of any requested materials or files. and it is likely that the new process under MIPS will be similar. If you have multiple tax identification number TINs within your organization, start organizing your documents and files at that level, whether you have chosen to do submissions by group or individual, as the TINs are the highest level of reporting for MIPS. Then organize by provider NPI number below that. Keep unique folders for each reporting period or calendar year, and further, set them up for the unique categories within MIPS: quality, improvement activities, and promoting interoperability. The key is to keep these documents organized and ready to submit according to how you reported for MIPS, by group or individual NPI, and keep the MIPS category documents, once again quality improvement activities and promoting interoperability, distinct from one another. If there is ever turnover at your organization, this can be doubly helpful, as we saw organizations scramble when program responsibilities were handed off to new individuals, who then had little to no idea where documentation was stored or if it even existed to meet auditors' requests and fulfill the required deadlines. Thank you for taking time to learn about MIPS audit readiness. Please feel free to get in touch with your state-appropriate contact as shown on the slide here for further questions, or to request the Excel Audit Readiness tool if you are unable to locate it or download it from the web page.